I'm Dr. Shim Ching. I've been performing plastic surgery for about 27 years. I practice in Honolulu. I also see patients in Dubai and Doha. And over that time, I performed about 30,000 procedures. And one of the most common concerns I hear is, my face looks okay, but my neck is giving me away. So today, I want to explain why the neck often ages faster than the face, why most people try to fix it in the wrong way, and what actually works to restore a clean, youthful neck and jawline. First thing to understand is that the neck ages for reasons that have nothing to do with surface skincare. The skin on the neck is thinner, it has less structural support, and it's exposed to years of movement and sun. Beneath the surface, the platysma muscle begins to separate into vertical bands. Fat can accumulate under the chin, and the deeper structures will start to loosen. Some people also notice that their salivary glands become more visible as everything relaxes over time. What most patients do is start with cream, serums, or tightening lotions. Those can improve the surface of the skin, and skincare is always important, but once you have loose skin, bands, or a soft jawline, creams can't fix the deeper anatomical changes. They simply aren't reaching the layer where the problem lives. The next category people try are non-surgical devices. These can offer small improvements in the right patient, especially if the skin is still firm and the aging is early, but they're not a replacement for structural correction. If you have true laxity, banding, or a heavier neck, these devices are often too superficial to create a meaningful or long-lasting result. This is where surgery becomes the most effective and efficient option. A well-performed neck lift or deep plane face and neck lift allows me to reposition the deeper tissues, tighten the muscle, sculpt fat where needed, and restore definition to the jawline. Instead of pulling just on the skin, I'm working on the deeper foundational layer, which is why the results look natural and last much longer. A common question I hear is, can I just do a little liposuction underneath the chin? Liposuction can work beautifully for somebody younger who has good skin elasticity and only a small amount of fat. But if the skin is already loose or the muscle bands are visible, removing fat alone often makes the looseness more noticeable. In those cases, liposuction needs to be combined with tightening, or we focus on correcting the deeper layers instead. One of the biggest concerns patients have is looking unnatural. They don't want to look pulled or tight. A natural result doesn't come from stretching the skin, it comes from restoring the underlying structure. When that foundation is corrected, the skin can be redraped gently and the jawline looks clean and youthful without looking operated on. So how do you know what you need? If your issue is mild sun damage or early texture changes, skincare is a great place to start. If your skin is still firm and you're looking for a small improvement, certain non-surgical treatments can help as long as your expectations are realistic. But if you're seeing loose skin, banding, a softened jawline, or fullness under the chin that isn't responding to anything else, surgery is usually going to be the most reliable and transformative option. The best outcomes happen when we address both the deeper anatomy and the surface quality of the skin. Surgery can lift and tighten, but maintaining skin health afterwards with sunscreen, retinoids, and medical-grade skincare helps the results last even longer. My goal is always create a natural result that still looks like you, just younger and more refreshed. When we choose the right approach for your neck, whether that's skincare, non-surgical treatments, surgery, or combination, you should feel even more confident every time you look in the mirror. If you're noticing changes in your neck and you're not sure what the best option is, I'm happy to walk you through it during a consultation. And if you found this helpful, please like this video and subscribe. I talk about many topics in facial rejuvenation to help you make informed decisions about your appearance.